And welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Muhamad Aly Rifai, psychiatrist and internist. Today's Kevin MD article is In Medicine and Law, Professions that Society Relies Upon for Accuracy. Muhammad, welcome back to the show.
Thank you very much for having me to talk about this timely topic on accuracy and integrity in medicine and law.
All right. So tell us what this article is about.
So in this article, I write about how integrity and trust is foundational now in our society, with all of these news that sometimes is not trustworthy, sometimes things are not accurate. And trust is really under assault. We see that in the field of medicine, where there's a lot of things that are questionable. There are a lot of things that are being reevaluated. I talk specifically about my field in psychiatry. It's just being uprooted completely. We are questioning whether antidepressants work, whether other medications work. Our foundational thoughts about the pathogenesis of depression, anxiety. We know, for example, that Alzheimer's dementia, there have been some research that has not been trustworthy, that has been manipulated for many years, and that has diverted our effort in terms of research and in terms of treatment. And in comes in artificial intelligence, AI, and that has created even a much more crisis in terms of trust. And media now calls these things artificial intelligence hallucinations, AI hallucinations. They've gone even as far as calling them AI fabrications. And these are dangerous. And we're seeing that on a regular basis in terms of the fields of medicine and the field of law.
So specifically in medicine, say, what are some examples of these fabrications or hallucinations that you are seeing?
Sure. So it's quite interesting because, AI just burst on the scene and we still have little understanding about how it works. We call them large language models. It's a computer trying to mimic us humans in terms of making a product to our demand and to our prompts. But we fail to realize that what it does, it actually mimics our behavior. And we humans invariably make false statements, incorrect statements sometimes. So false statements, incorrect statements, sometimes we intentionally lie. I, in my field of psychiatry, experience individuals, for example, who have schizophrenia, who experience hallucinations, who have misperceptions of reality. And even though that's very rare, but that kind of bled into the large language models. We've also seen that inability to control the artificial intelligence has really kind of escalated that. And now when you purchase or engage an AI model, they basically give you the disclaimer, oh, this AI is 90% hallucination free, versus that shouldn't be the issue. So in medicine specifically, I reference a recent event that happened actually after I wrote the article, where the Department of Health and Human Services had to retract a position statement because there was an argument that several papers that were referenced were actually AI hallucinated. The experiment that I reference in the article, which is basically a schizophrenia researcher who actually wanted a question answered by ChatGPT, the most prominent large language model artificial intelligence that's available. And it talks about schizophrenia research. And he was surprised that out of five article references, scientific references that he requested, all these fives were actually fabricated. Two didn't even exist. Two were actually papers, but the artificial intelligence model gave him an answer that said something different than the paper that was referenced. And then one was actually complete fabrication out of the blue. So it's quite interesting that we really are seeing that in the field of medicine, that now we are seeing papers that have hallucinated scientific references, and that is bleeding even into position statements from the United States Department of Health and Human Services, where we saw that they actually retracted a position statement because it had AI hallucinated scientific references.
So you're seeing it, of course, in the areas of medical research where these citations are fabricated or hallucinated. Are you seeing your fellow colleagues perhaps going to ChatGPT and looking up medical information and getting wrong information back? Or are you seeing patients also using these large language models to ask questions and again getting hallucinations or false information back?
So I'm actually seeing both. And so I'm seeing patients that are going to ChatGPT at least once a day or twice a day. I would get a patient who would give me a comment that they consulted ChatGPT on undoubtedly a complex medical problems. Specifically, I deal with treatment resistant depression, and invariably they consult ChatGPT. And importantly, now ChatGPT over the last 3 months have actually put a disclaimer. Please check your information. ChatGPT may give you wrong answers. That disclaimer was just added. So they are identifying that they do not want liability to a patient going to ChatGPT and asking about a treatment or requesting a treatment, getting a treatment, and then basically seeking legal liability from ChatGPT. I'm also seeing colleagues who actually are experiencing that in terms of production of papers, in terms of finding references, in terms of basically going for answers. Sometimes it's very important that if somebody consults ChatGPT on a complex issue is to actually check the reference that ChatGPT is relying on. Most variably, if it's a settled matter and ChatGPT is giving you a position statement about, for example, professional organization, most of the time the answer is correct, but you still have to check. But, sometimes it will add or editorialize sometimes and may give you the wrong answer or the wrong conclusion. Even though it listed the raw information correctly, it gives you the wrong conclusion for the question.
In your article, you talk about an analogy between filling informational voids and the brain's response to sensory loss. So, talk more about that analogy from your perspective as a psychiatrist.
Sure, sure. So I encountered that actually, and there is literature in a patient who actually was diagnosed with schizophrenia, and I doubt he has schizophrenia, but he had hearing loss during childhood at age 2, and he actually received cochlear implants. And that phenomena is well known that individuals who have cochlear implants will experience hallucinatory experience or fabricated sensory input from the cochlear implant, just specifically because the software of the cochlear implant will think that there's a sound or there's a voice in the environment while there's actually no stimuli. And so invariably, individuals who have cochlear implants will hear conversations in the background, even though it's quiet, there's nothing going on. And it's actually the software for the cochlear implant trying to fill the void that it can't be silenced. There's something going on. And so it kind of hallucinates or fabricates some noise. And so this patient was hospitalized so many times psychiatrically until we figured out that is a phenomena from the cochlear implant. And I talked with audiologist, I talked with his ENT who worked on the cochlear implant, and they're trying to see if there's any software adjustments to reduce that phenomena seen in cochlear implants. So we are seeing that large language models, ChatGPT, Grok, Claude, they're mimicking what humans are. They're not coming up with anything. They're not making any discoveries. They're not like Newton or Einstein. They're coming up with novel ideas. They're just mimicking our behavior, and sometimes humans lie.
So, tell us about the path forward in terms of accountability. Clearly, these AI companies, they don't want accountability for that, hence the disclaimers. So, is the responsibility shifted more towards the end user in terms of being careful themselves in terms of what they're asking these chat GPT models?
Sure, absolutely. The responsibility has shifted to the end user. And I bring the example that I put in the article. And there's another example, which is actually from the field of law, where lawyers actually basically filed a brief with the court. And what ended up happening is that there were hallucinated case references from the brief in the that was submitted to the court. We've also seen another case recently where actually the lawyer submitted a brief that had AI hallucinated case references. The court, without even checking that, put an order that referenced the AI hallucinated cases. And actually, it was only after the opposing attorney pointed out that these cases were hallucinated.
Mhm.
And so, actually, the lawyer was sanctioned by the court and had to pay $2,500 because of unprofessional conduct. Now there are district courts, federal district courts, or state courts where they have actually blank statements about the utilization of large language models, AI, in terms of basically not using AI in that field. So it's very important. It has shifted into the end user, and I can tell you, for example, us physicians, we use AI for dictations, for medical
Mhm.
dictations. And invariably, the AI is going to say something wrong. And invariably, there's going to be a malpractice lawsuit where some text that was inserted by AI that was never said is going to come up and somebody is going to pay the price for that. So it has shifted to the end user, and the companies that do these AI models are just washing their hands from any liability.
Now, from a medical standpoint, what kind of advice do you have for physicians when they use these large language models in clinical practice or research? What kind of guidelines can you share?
I think that we need to develop a stringent standards for disclosing that AI was used. So anybody who uses AI in any scientific production article should disclose that AI was used in that article. I know, for example, now pictures that are being published on the internet or on any platforms now have an AI disclaimer.
Hmm.
It will say that this picture was generated by AI. And the industry also must participate. They have to enforce verification tools that flag fabricated citations, articles, law citations, and they have to work actively to see how they can curb this phenomena. But it has significantly proliferated into the known large language models that are available. So, and also to put a measurement. So they have to, like contaminated water, for example, they people met, or the air quality.
Hmm.
The AI companies have to put in disclaimers. Okay, our AI now is only doing maybe 10% hallucinations, so you have to be careful with that, and that needs to be verified. So we really have to advocate also for clear terminology, distinguishing hallucinations from fabrications, and seeing how we can kind of stem that phenomena, because otherwise it will just that those fabrications and hallucinations and inaccuracies are just going to invade our field in medicine and law, and are going to lead to very bad consequences for our patients, for clients in the field of law, and for litigants. And there's going to be litigation coming pretty soon.
Now, as you know, the speed of innovation when it comes to AI has been exponential because the models that we're using now is just so much better than when they first came out. You have these reasoning models that are passing the most difficult tests possible, and the benchmarks are only going to get better and better. Are we going to come to a point where we can stop worrying about hallucinations and trust what's coming out of the AI, given how fast the improvement pace is?
I don't think so. I think that we really stand at an ethical crossroads. We must really actively decide whether we are willing to surrender these critical standards of truth and accountability to the convenience and the technological expediency. I mean, so we really need to put our foot down. For example, as medical professionals, we're sworn to uphold truth and justice. So we must resist that erosion. And basically, we cannot kind of trust that, yes, now that we've seen that this model is able of fabrication, hallucination, we must not say, okay, no, we fixed it. It got fixed, because patients in the law field, clients, and our profession really depend on that, depend on us standing down and standing up and saying that we cannot continue to experience that. So the companies that do these models, they have to work actively on trying to stem this phenomena.
We're talking to Muhamad Aly Rifai, internist and psychiatrist. Today's Kevin MD article is In Medicine and Law, Professions That Society Relies on for Accuracy. Muhammad, let's end with take-home messages that you want to leave with the Kevin MD audience.
Artificial intelligence and large language models are wonderful tools that aid us as humans and can be extremely productive. However, in the fields of medicine, in the fields of law, we have to be very careful because these tools sometimes create fabrications, hallucinations, misperceptions, and we have to advocate for truth and integrity in our fields. So I advocate for standards to be created by the companies, by professional societies, by scientific articles, by courts to be able to regulate the utilization of artificial intelligence in those fields.
Muhammad, as always, thank you so much for sharing your perspective and insight, and thanks again for coming back on the show.
Thank you very much for having me.